I'm going to take a roll call real quick.
Okay.
Commissioner Cowan,
Present.
Commissioner Galansky Pisanya, a roll call.
Here.
Commissioner Munguia. He's still not on, Mayor. Commissioner Gowan,
Present.
Commissioner Tetro, Commissioner Neese,
I'm here.
and Mayor Mendez.
Here, thank you. I'll now call the meeting to order.
It is now 5:03. I will go ahead and read the notice. Notice of a special meeting of the City Commission of the City of Brownsville, teleconference open meeting, pursuant to Chapter 551, Title 5, Section 551.041 of the Texas Government Code. The Texas Open Act notice is hereby given that the City Commission of the City of Brownsville will conduct a special meeting on Tuesday, May 26, 2020 at 5 p.m. via WebEx teleconference meeting. Our meeting number is 966-002-339. The password is meeting. This notice and meeting agenda are posted online for your convenience. The members of the public wishing to participate in the meeting hosted through WebEx teleconference can join. We will now be, the meeting has now been called to order. We will have the invocation.
Yes, let's go ahead and I wanted to start with a quick Bible verse. It's Proverbs 16, verse 3. It says, commit to the Lord whatever you do and your plans will succeed. And then I'm going to move into verse 9 real quick. It says, in his heart, a man plays his course, but the Lord determines his steps. Let's go ahead and pray. Heavenly Father, we come before you right now, Lord. We're asking for each and every, for our city mayor, Lord, and our city commissioners, Lord. Anyone who's going to take part of this meeting right now, Lord. We ask for you to be able to interfere right now, Lord, and we put this meeting in your hands, Lord. You say in your word that in our hearts we plan our course, Lord. But we pray that you establish our steps, that we will be able to seek your advice, Lord, and let us not make decisions, Lord, upon what we know, Lord, or based upon our knowledge, Lord, but we ask for your knowledge and your wisdom, Lord. Please guide us today, Lord, in this meeting. We place this meeting in your hands. We place our hearts and our mind in your hands. So please direct our paths, that anything that will be decided today, Lord, let it be established for your glory. We ask you this in the name of the Father, the Son, and the Holy Spirit. Amen.
Thank you, Pastor Gutierrez.
You're welcome.
Thank you, Pastor.
We will now begin with the presentation.
Risela, my understanding is that Dr. McCormick will be requesting to be put on another agenda. He's not ready today.
Correct, sir. I was just going to mention that the presentation will be postponed until June the 2nd. So we'll move on to the next agenda item, which is the public comment period. I did not have anyone sign up for the public comment, so we'll move on to the work session. Work session number 1, discussion regarding the City of Brownsville response to the urgent public necessity concerning COVID-19, otherwise known as the coronavirus, included but not limited to content plans, staff, facilities and services, including access, content to such operations, letters of financial update, emergency procurement, and letters of drive-through inspection testing site update.
Good afternoon, Mayor, Commission members. For item A on the continuity plan update, the BTX Recovers Committee will have the first draft of the reopening plan available for review and discussion at the June 2nd meeting, so next Tuesday. Also, in our discussion we had, Mayor, late last week about moving back to the regular scheduled meetings every 2 weeks. This will be the last weekly meeting we'll have on COVID updates. We'll continue providing those at regular meetings, and during the in-between weeks, we'll provide a weekly report with the same PowerPoints you're seeing for the drive-through and for finance, unless the Commission has a different perspective of continuing the weekly COVID updates. And that's all we have for item A. Are there any questions or comments?
Question.
Yes.
Are you still at the same levels of employee working? Like you mentioned last time, said everybody's still working, nobody had been furloughed or laid off or any of that.
No, no, I can actually forward you. The HR department just in fact sent out that latest update. We have that sent weekly. Our percentage of employees that are teleworking has been at 12%. There's been a 1% drop since last week, and I'll forward that to the commission here shortly. But other than that, Commissioner, everything remains the same.
And so that's like, what's the percentage of people still working? 90 something?
Oh yeah, well they're all working. Those that are physically working, it's around 89%.
Okay, and then you got 12% that are teleworking, right? Something like
Yeah,
that.
between 12%. It was 11% this week, but again, it's negligible.
Thanks.
And Mr. Bernal, what about City Plaza? What are the operations at City Plaza right now?
Most of the operations, after we had that incident where there was a positive employee, arrangements were made where most of that could be done through telework, but also drive-through has been the primary method for City Plaza services. I know that for planning and redevelopment, they had the most challenge with doing it through a drive-through, so they were coordinating with the credit union to use some of their spaces. They're also looking at potentially outfitting another location in downtown that could temporarily serve their needs. Otherwise, the city secretary's office, municipal court, parks only has administration there. Most have been able to adapt their services. And they've limited foot traffic tremendously and all that. In the reopening plan, there are going to be facility retrofits, recommendations for different facilities. There is going to be, for example, City Plaza, the option to change the doors to automated doors versus the current ones, and also having kiosks set up for more self-service. So there are additional enhancements that would be recommended, but for now, it's simply going drive-through for the most part.
Okay, and are we limiting the amount of individuals that come in, and are they being asked to wear facial coverings?
I didn't get the second part, Mayor. Are we
limiting the amount of individuals that are coming into City Plaza? And then second, are they being required to wear facial coverings?
Yes.
Okay, thanks. Any other questions? Okay, item B.
If I may ask, Noel, this is Nurith. To get permits, though, so how do they go about it? Do they go in person? Do they call to set up an appointment, or how does it work?
They've been doing mostly appointments, but they've also done curbside, and then they've tried to allow them to submit digitally. We don't have a fully digital platform, but they basically, staff is required that they submit just plans that they can scan because we don't have a way for them to upload. So it's digital, curbside, and some in person as well. But they're trying to make sure that staff that has PPE or that they meet the citizens. Typically, curbside is the best approach because they haven't had a good system for drive-through for planning yet.
And what about meetings for the Planning and Zoning Board and Board of Adjustments? Like, have they been approving subdivisions and all that?
That had been delayed because of some technological challenges, but that's already in progress. I don't have the exact meeting date offhand on when that'll next occur, but there had been a setback for as long as we've been facing COVID because planning didn't have a lot of the technology needs to have the remote meetings. But that they've made progress. I'm not sure if Gail or Rick are on here to speak to where they are with regard to the change in virtual meetings.
And Commissioner Galansky, I also found out about that issue last week, coincidentally, and I was not very happy about the fact that planning was not moving forward because of a technological issue. So I made it very clear to staff that we needed that fixed right away because it was costing the city money and delaying projects and other construction.
Helen, do you have the latest on where planning, where Rick and Gail are with a lot of those changes?
I know that Gail had to get on the phone with Dell and ensure that the order for laptops and computers were available for our P&Z staff and for, our board members and staff. And I know Rick did tell me there will be a meeting in June. I don't have the exact date, but we will follow up But we are having a meeting in June. We do have some rezonings that we need to make sure that they get pushed through the system soon. And I will also check on Board of Adjustment, but I know that we had to get some equipment calls to Dell to deliver for quick delivery last week.
Thank you.
In general, though, do we foresee ever going back to in-person meetings, or is that feasible?
That's a good question. There's likely a hybrid system that could be implemented. It could facilitate a lot of the meetings. One of the things we're doing for staff, for example, is we're going to try to make sure that we can incorporate as much as we can on the remote work side. In terms of boards and committees, that's something we haven't fully explored, but it is an option that we can also consider.
Thanks.
And planning was the only department that we have knowledge of that had fallen as behind as much as they had with some of the technology, but we're moving very assertively to make sure that they get the needs that they were lacking.
Okay, can we get that done as soon as possible then?
Yes, we'll send you all an email update on that also.
Thank you. Any other questions on item A? Okay, item B.
Good evening, Honorable Mayor, City Commissioners. I'll go over the financial spending update as of May 22nd. We have expenditure summaries. We have broken up basically into two categories: budget expenditures or personal cost-based pay, about $3.9 million. Non-budgeted expenditures totaling about $2.4 million. The different categories listed on there is personal costs, emergency pay, overtime, supplies, emergency procurement, which I'll go over right now, PPE, masks, and drive-through testing. Total COVID expenditures about $6.3 million. Next page, please. The different categories or buckets associated with the expenses are listed on there. The total cost of non-procurement expenditures is total of $6,022,000. Next slide, please. On personal costs, we divided up into different categories: police, fire, and other departments overtime. And within the police and fire, we broke it down further into what's base pay and what's emergency pay or hazard pay. Total personal cost about $5.9 million. Next slide, please. On emergency procurement, initially we had made a emergency procurement about $60,000. What this represents, PPE mask, is only about half of the order. The second half of the order was canceled, and an alternative vendor was identified because the first vendor didn't come through with the second half of the order. The order was not paid for. Only what was received was paid for. The second procurement item that we have here is a drive-through collection testing, which includes operating costs for medical staff for the amount of about $72,000, and testing kits of about 1,100 testing kits. These are testing kits that are for uninsured patients on totaling about $128,000. Next slide, please. This concludes the presentation. Have any questions?
Mr. Granao, I have a couple. On the last slide, can we go to the one just before this, please? Okay, on the drive-through collections testing site, is that up until yesterday, or what day is this?
This is up to last week. This is up to May 22nd, sir.
May 22nd, okay.
This is actual 43 days.
Last Friday, okay. And then on the PPE mask, we've been hearing the same story for a month already on how we ordered some, we only got half, we only paid half. When is the rest? I know that we're not going to rely on them to come up with the rest. I get it. But we ordered from another supplier, so I'm assuming it's been about a month. I haven't heard any news on when we're getting more PPE masks or any other PPE equipment.
Currently, I believe we have we ordered and received about 5,000 PPE masks. Initially, we had placed an order about 20,000 masks. That vendor, the vendor that we placed at 20,000 masks had it in back order. but not waiting for that vendor to come up with deliver the 20,000 masks. We found an alternative vendor that gave us at least 5,000 PPE masks so that we could continue operations. We checked with the fire department and they said that was adequate for them for right now, but we sure would like to have the 20,000 masks to be delivered.
But they have been ordered then?
The 20,000 have been ordered, but they're on back order with the vendor that we have. The
Okay.
5,000, with the 5,000 we ordered, they have been delivered. And we
I
have them.
understand. My concern is just the remaining 20,000, because we understand that there's a back order. I just don't want to be expecting that we can order and receive them quickly, because that's certainly not the case. So the ones that are back ordered, the 20,000 that are back ordered, how long have they been back ordered?
Oh, don't have at least a couple of weeks or not, but we're not waiting on that back order. What if we need to, we'll go with a secondary vendor similar to the 5,000 that we ordered. We'll
Okay.
go with that vendor to get any supplies, PPE supplies that we need. The
Okay.
reason that we're holding off on the 20,000 vendors because we got a pretty good deal on that 20,000 order. Very, very economical, and it was financially advantageous to the city. And that's why we're holding off on that particular procurement.
Okay. Thank you. Anybody else have any questions?
Yeah, I do. Two slides, it looks like, probably.
Commissioner Neese, can you speak up a little bit when you, we can barely hear you.
Okay. All right. Can you go back a slide? Can you go back a slide? Can you hear me okay now?
Yes.
Yes.
So my question on this one is, if you can break down these costs into categories. For example, you have police costs for personnel. You break those down by department, like traffic department and just the major divisions. You don't have to go into that much detail. And then the same thing for the fire department. So we can get an idea exactly where it's going. So the other thing would be, and the other departments. And if you go back another slide. Okay. So, no, one more, please. Well, actually, that one works. Okay, well, see where it says supplies, lease, and other costs?
Yes.
Okay, so advance to the next slide. Can you let us know what that is? So, you don't have to go into every purchase or anything, but just give us ideas of what the supplies are. What are the lease costs? What are we leasing in the contract? And you don't have to do it as a presentation. You can just email it to us, and we can get an idea of the subcategories of each of those.
Just general question. There is a footnote of what those supplies are. Like for supplies, it has janitorial supplies, N95 masks, thermometers. Do you want a further breakdown of this?
If anything that's related to this emergency operations that we're doing.
Okay.
And so if it's just normal stuff, then don't worry about it. But anything related to the COVID operations. Okay?
Okay.
And just
Okay.
mail it out, or you can mail me. I don't know if anyone else is interested.
Yeah, I'd be interested.
So just to make sure we're clear, the footnote that's on there, you want that enhanced to some degree?
Yeah.
Okay.
Probably itemized based on the cost for each of those sub-items. That's what I'm assuming. Is that correct, Commissioner?
Yeah, cost on the item. There you go. Yeah, please.
Okay.
And then on the personnel, if you would, for example, the hazard pay, what departments got it at the police department and at the fire department? What divisions of those departments?
Okay.
Better picture.
Okay.
Thanks.
Mr. Granado, just to clarify on the personnel, we have 5.8 million. Can we go back a slide? There we go. Personnel 5.8 million. if we see that breakdown right there, it's not all 5.8 million based on COVID. The only real COVID part is the overtime. Is that right?
That's correct.
Okay, so this COVID-19 impact includes a base pay as well.
It includes a base pay, and we put it on there in case it would be an eligible cost, but yes.
I understand. For the purposes of reimbursement, I can understand that being on there, but just so that individuals understand the amount that we've actually spent COVID specific, it would be the overtime pay and the emergency pay, right?
Yes.
Okay.
That's what I was asking for the breakdown for.
Thank you.
Honorable Mayor, Commissioners, good evening. Wanted to update tonight on our drive-through testing site for COVID-19. These numbers are current as of May 22nd, 2020. To date, we've administered 2,532 tests. Of those, we also have had 2,063 that were not within the criteria. Our running total for insured to uninsured, if you notice, is now at 50-50. Over the last few days, weeks, actually, we've actually increased the uninsured. We've been trending about 52-53% insured and 47-48% uninsured. And here, most recently, we did see an uptick in the uninsured come through, which is a really good thing for the community, because we're seeing people who previously were not coming to us now coming to get tested as well. In addition, we have reported from our labs to the county through our contractor 141 positive and 2,095 negative results. We do have at this time 374 results pending. Also, the next slide, as you may recall, we shifted to swab from sputum on or April 18th. Mm-hmm. And you previously, I believe a commissioner member or mayor asked us previously about what the positivity rate was, so we wanted to present this slide to you tonight. Using a sputum-only sample, our average sputum positivity rate is running at 4.9%. In order to try and keep this data as pure as we could, we used days where only sputum had been done, which was 5 days. We then took a mixed sputum and swab, and we identified 13 days where we had used both sputum and swab through the drive-through. And we got an average mixed testing positivity of 6.1%. And then we took a swab only, and that's pure for those days, which were 23 days where a swab was only used, and we got a positivity rate of 7.1%. So I think the question had been, going back to that slide, the sputum versus swab. The good news is that both of them have now been, the CDC continues to do testing. And these are the numbers that we have using PCR testing. And the CDC, as these PCR tests are getting more accurate, is actually continue to recommending swab and sputum only. Mm-hmm. And that's a very good thing to have, because although at the time we did begin with sputum and move to swab, we're really glad to see that the CDC, as they're making the PCR testing of higher sensitivity, they still have contained swabs and sputums in the criteria. Next slide, please. So these next two slides are meant to give a background on the data that you're going to be seeing. As you may recall, Executive Order GA-18, the one effective May 1st, asked all Texans and essential services to remain open. There was some minimized social gathering and some in-person contact. What we're going to try and present tonight is, as these executive orders, GA-18, if you can go to the next slide, and GA-21 did, they started to open up the Texas and Brownsville specifically to different social venues, 25% occupancy and 6 feet social distancing between nail salons. So the next order, which was GA-23, actually has two effective days, May 18th and May 22nd. The reason I'm highlighting these GAs and the date is because the next slides that you're going to see how the rates of both testing and positivity results were impacted by these GA orders. Next slide. So GA 23 had multiple effective dates. You will notice on the slides when we go to the graphs that these two dates also showed a difference in the impact in our data that we're collecting now. Next slide.
We should anticipate.
Yes, and this last slide is what we're going to anticipate. We're going to continue the trend of increasing rates of testing, but also increasing positive rates coming out of each executive order. GA 23 we suspect is going to be no different, especially as we see more businesses, more type of sports opening up, religious services, and so forth. So let's now go into the data slides.
Next slide, please. All right, and this is our traditional slide that we have been showing of our cumulative cases and our estimated recoveries. And this is just what we're trending over time, so we can kind of see the increases. You can see little bumps. Next slide. All right, now this right here, we've altered this slide slightly. This is our traditional daily case and death counts, but I've also added the 7-day moving average, and that kind of transforms the data, makes it a little flatter, so you're getting a better idea of what's going on instead of having 10 at one time and then 0 at the next day. It kind of flattens it out a little bit and gives you almost like if we're reestablishing a possible baseline. And so as you can see, May 1st is when the first executive order went into play, and you see a slight uptick in that trend line in some of the cases, and progressively with each additional opening or executive order, you're going to see just a slight movement. So at the baseline, right at the May 1st, we were right about 4.8 on the moving average for cases. And now towards this, the Executive Order 23, we've kind of increased. We did get up to almost 10, but we've kind of done a slight decline, but we expect that to kind of go up again with each additional executive order where we're having new establishments reopening and increasing their capacities, and different sectors or entities being able to participate in the reopening. But that's what we're doing, is we're starting to track that so we can see if we're establishing a new baseline, or if there's something that we need to see that's really going to trigger us to kind of pause and maybe have to take some kind of action within the city. Next slide. And what we also did is we wanted to see what kind of infectious infections, source of infections that we were seeing based on the beginning of the reopening. Travel, we don't have anything highlighting that because that's kind of just stayed constant. That was more of a increase, and so we've kind of flatlined down here. But if you look right here through the community and through the link to previous cases, we are seeing that uptick. And that's the community one, is the one that we really want to keep our eye on, because that's when we do not know where that infection came from. We don't have a person that it's linked to, a space, or other than symptom onset, we don't really have a time frame. So that one's kind of like our mystery. And as you can see, we do have some of those upticks as we're going through with the openings. We are seeing the same uptick also in the link to a previous case, but one of the positives with the link to a previous case is that we can proactively start shutting down and containing an outbreak in that section. But this is just to show you that we are seeing that uptick in community spread, and we are seeing an uptick with the link to the previous case as people are venturing out with their families and kind of reconnecting to maybe some of their loved ones that they hadn't seen while they were sheltering in place. We can go to the next slide.
Can we briefly go, I'm sorry, to the one before, the one before this one? There you go, that one. I'd like to point out something, with the exception of the date that was 4/11 or 4/12 on the far left, all the other dates that have had the highest number, we can clearly see all the way to the right, starting with 5/6. All of our highest incident days have been in the last 2 weeks. So it's very clearly, we're starting to get double digits almost on a daily basis. So it's important for everybody to understand that the numbers are increasing on a daily average, and it's not like we're testing more people. So we're getting a lot more positives on a daily basis, and I just wanted to point that out because with the exception of that one day, like I said on the left, every other day double digits and above has been recently.
Mayor, I want to add, if you look further left at the April 1st deadline and how you see a steady increase in that 7-day moving average, that's when we started the drive-through. And as soon as we started testing, we started to get a real good idea for what our numbers were looking like. And that's the power of testing and doing what we're doing, is that it gave us a clearer picture of where we were at the very beginning. So that one spike that you see on the 11th, we think that was, in effect, our testing and able to come back and see where as a community we really stood. So that snapshot is kind of a control in a way, because we're able to look at that and now look how the orders are impacting us as a community.
Right, and for that 3-week period, almost from about 4/13, let's say after 4/12, from about 4/13, 4/14 to almost the end of April, it was pretty flat. It was, we're only getting a handful, less than 10 a day. That was during the shelter-in-place orders. Then as we see towards the end of April, that's kind of when things started getting released and started getting softened. So we started to see those numbers go back up.
Yes, sir. And I want to add, how does this translate with our conversations with our medical community? That in the calls, we're seeing an increase in their ICUs holding up a few more people. We're seeing the labs taking a little bit longer now as more people are testing. And it presents the very real issues that we do what we do here, is to know exactly where we stand on the positives and even the negatives to give us an idea where we're trending towards.
Mm-hmm.
Well, I know that Dr. Gowan can speak to this as well, but on the hospital call this morning, we heard from both administrators stating that individuals coming in with influenza-like or flu-like symptoms continues to be higher than average for this time of year and continues well into this period, which is abnormal. Am I right, Dr. Gowan?
Yes, and that is very clearly seen by both hospitals. And on a spot check of a small number, a high percentage of those so far are actually turning out to be positive from COVID. Problem is, in the beginning in April and really up until the last week, the hospitals were not testing the people that were not sick enough to be admitted. So that combined with the fact that we know that 30% of patients that are positive have no symptoms, all of the numbers in front of us are probably higher. We just don't know it. And where the people get the infection from the community, as she was saying, that we don't know where they got them. It's very possible that they got it from an asymptomatic carrier, meaning someone who we and they do not know is positive. And so it's clear what Art and his team are saying. It's clear that this is not over. It's not time to just think about haphazard recovery. It's time to think about very careful and very strategic recovery.
Yes, ma'am. So can we go forward 2 slides?
Yes, thank you.
Thank you.
All right, and this is once again where we're just categorizing by the age groups, and we have seen a slight uptick with the 80 plus, which kind of gives us a little bit of concern. We are still seeing the majority being in the 50 to 59 and the 20 to 29, but we always want to make sure that we're monitoring anything from 60 and above also, because that's where we can have some of the more, not that we don't want to monitor the others, but we spend a little extra attention on 60 and over, just because they are one of the more vulnerable populations. And we want to make sure that if anything develops in that area, that we are really rapid in any response that we're giving to those. So we're constantly monitoring those daily. And then the next slide.
Can I also ask on this graph, can I also ask that you start to track the, unfortunately, the fatalities by age group?
Yes, sir. Yeah, that's not a problem at all. I'll make a note of it.
I think there's been 3 that have been reported, but
that's correct.
We're well aware that the number is much higher. They just have not been reported yet. So,
that's correct. We'll add that to the slide moving forward. Good point.
All righty. And then We also want to discuss some of the items that were going on with our boots on the ground operations. We've completed day 26 and we're doing the citywide operations. Currently, our concentration is in the downtown and surrounding areas. We're working with the census to target also some of those areas that are having really low turnout. And since we still need to go in and do outreach in those, we're partnering up with them to see what kind of impact not only do these outreach methods have, but also how does it help with our census numbers. And it's real simple. We just have some information that we put in the bags on that. So just be kind of aware, but we're doing the downtown area, east and west downtown. So far, we've reached 16,655 households, which is approximately 32% of the households within Brownsville. And as always, we have anywhere from 5 to 8 staff members participating in these in the morning. Next slide.
So this next slide is kind of a portrait or a picture of what it is, to Dr. Gowan's point and Mayor Mendez. We're thinking both proactively as where do we need to be? How do we need to be preparing? Do we need to be ramping on, ramping down, ramping upward? Do we need to be pivoting? And some of the things that we're identifying is, and having our conversations with our contractor, is we've gotten better at what we're doing. So there's right now capacity with a scheduler that we've been able to have a conversation and reduce one staff support at the scheduling level. We did have a conversation, and if there's many more drive-throughs or many more opportunities out there for testing, ramping down is something that can be accomplished within 24 hours. In addition, we are evaluating May 22nd phase 2 measures very closely, because we're going to look at how the impact in our city comes about within the next 2 weeks. As reopening measures did result in some positive increases, as you saw in the charts, and increased testing is going on at the drive-through, especially with the uninsured. We know that we are reaching people, but there's always more that could be done in Brownsville. Dr. McCormick has mentioned to us plenty of times that he thinks at the very least we should be reaching at least 200 tests and more per day. And then as these measures open up more of the community, whether we need to pivot to ramp on or ramp down, we can do it as part of our recovery plan. Next slide. So some of the recent recommendations that I've heard in having conversations with mayor and commissioners, you've mentioned to us potentially testing of the asymptomatic, as well as expanding the criteria. And that certainly is something that we could do by picking up the phone and letting our contractor know. And other considerations is for us as a city to consider testing all employees prior to us ramping down as well, to know to have that with us. And once closed at the sports park, the drive-through, there are opportunities to continue testing via our contractor. And as we've heard before, I believe Dr. McCormick mentioned it when he presented last, and I believe I've mentioned it as well, the serology testing, which is the IgM, the IgG, and the IgA testing, which is a way of looking at the proteins or antibodies in the blood, and it's a blood test, to be able to know whether someone has been infected and has antibodies or whether someone is currently infected. It's not a diagnostic tool, but it is something that tells us about our population and the status of COVID in the local population. Next slide. And with that, it's also important that that with regard to the drive-through and the boots on the ground, the actions both in containment and mitigating are multifaceted. And we wanted to take time to present a link, and I hope it's going to work now, to present some of the recent activity from our folks on the ground.
now the city, the public health department is focusing on an outreach of the COVID-19, which is the coronavirus, and also we're passing out flyers for the census.
Daniel Hernandez, Ordinance Enforcement.
Maria Torres, Ordinance Enforcement Officer.
Carolina Carabasilis, Health Inspector.
Freddy Alvarez, Ordinance Enforcement Officer.
Randy Rodriguez, Bonzo Police Department, Animal Control Division.
Everybody's a team, and I love the health department. It's a great team that we have here. A great team.
Our staff goes out there. They're out there at 6 o'clock in the morning and going door to door, leaving them hanging on the door handles or on the fence line. If we can't enter the property, we just leave them on the fence with their information.
Right now, we're going door by door. Every morning, we there at 6 in the morning and leave a bag with the information for the COVID-19 and the census.
Hit the ground running, baby, I'm running, baby, I'm running, running,
I mean, all I can say is that we have a great team right now. You know, this is where we come as one, and they just focus on what they need to do, you know, because, I mean, we all have families. We want to make sure everybody's aware of this pandemic.
So we wanted to acknowledge our team and communications for the great support that they've done for us. So
All right, I
thank
think
you very
that's
much.
a great video. Well done.
Good job.
Nice work, guys.
That's a good work.
Thank you. Any questions?
Well, I also would wonder in the end, when this is all said and done, and we don't know when that's going to be, but I would love to interview that team and say, you know, how did you feel during getting those 10,000 steps every single day? Did that change your sleep? You know, did you sleep better? Did you feel better? Did you have more energy? I'd love to see what that consistent increase in activity has done to them personally.
That's part of our employee wellness program as well.
Exactly.
Thank you. And keep in mind, we're hitting about 600 to 800 homes in 3 hours. So that's phenomenal work. Thank you.
I do want to commend you, Art, and your department for all the work, because I think we're starting to see the results. And not starting to see, we've seen the results for a couple of weeks. As we've started to see the amount of tests increase, we hit a low there for a little bit, but then we started to see the amount of tests or drive-through increase. And I think that's directly correlated to these efforts, especially in the neighborhoods that you've been hitting. So I really want to commend you for that, because we're able to get these folks tested and make them aware of the testing. And then also, I think I saw a picture where Commissioner Galansky went out there a couple days and did her part as well. So I'm assuming she got her 10,000 steps in.
I've spent many a morning with that crew, and I would gladly do it over again. They're they're a lot of fun to be around with, and I've learned a lot about the other stuff that they work with. Animal control, specifically trash collection, and it's important work, and we've learned a lot about, especially District 1, since most of the time we're in District 1. But that's a really good team to be on, and I've really enjoyed getting to know them all this time. So thank you for your work.
And Dr. Rodriguez, as far as ramping down, yeah, I wouldn't plan on ramping down anytime soon. I think you're going to have to continue to step these efforts up.
Thank you very much. I think my point and our point is understanding that we know we need to have some sort of metric timeline to know whether we need to pivot or not. And these GA orders do offer us those opportunities to look at our next steps moving forward. And on behalf of the health department, we continue to say thank you for the ongoing support from everyone.
Thanks.
Hey, Mayor.
Yes.
Before you close this item up, can you discuss or share our discussions with the governor's office from Tamaulipas with our community about?
Oh, yes, absolutely. That's really important. Thank you, Commissioner. Commissioner Neese and I had a conference call with the State Department of Tamaulipas last week, as well as the county bridge officials. And the message from Tamaulipas is overwhelmingly clear. They want us to know, they want Brownsville residents to know that they're strongly discouraging traveling into Matamoros. And that there's several reasons for that. One of those reasons is just the situation in Matamoros continues to escalate as far as COVID positives. Their access to testing is through the state. Testing is being done through the state. Their numbers are increasing. It's not exactly mirroring ours. I think they're probably about a week or two behind us in the way we've been trending, but their numbers are increasing. They actually have more deaths than we do. The amount of positives that they have is similar to what Brownsville has, but their amount of deaths is really, really a lot higher. I think it's
about half of the whole state. Remember they were mentioning that.
Right. Yeah. I think at the time we had 3 deaths and they had about 20 something, mid-20s deaths. Their hospital system is also a little bit more taxed than ours is. But what they're going to start doing is they're going to start implementing measures for individuals that are coming into Matamoros. It's a lot stricter restrictions, and those have been conveyed to us. Commissioner Neese and I got that, and we did ask for our communications department to put out a press release regarding those measures that are being taken in Matamoros, so Brownsville residents are aware of it when they're going over. But again, the overwhelming sentiment is don't come over here unless you absolutely need to, and we're strongly discouraging travel from Brownsville residents into Matamoros.
I think they turned back about 200 cars the first day, and that you have to have the mask. You can only have one person in your car. There can only be one person in the car. So they're really clamping down very seriously.
And I did hear back from Mr. Romero, who believe we're going to have a press release either later today or early tomorrow regarding these measures. And I'm going to have an interview as well tomorrow mid-morning. If I miss anything, Commissioner Neese, please elaborate.
That's pretty much it, but they have had, I think, about 65 deaths in Tamaulipas, and almost 30, I think 29 were in Matamoros.
Right.
They're really worried about it.
Okay, Dr. Rodriguez, I did have a couple questions on your presentation. You said that there was 374 results pending. Are the results that are pending, are those as a result of the testing taking longer to come back, the results?
So let me update that figure. We're now at 196, but to answer your question, yes, as we have more testing at the labs, which this lab happens to be in Austin. Keep in mind the governor's order to test all nursing homes has slowed down the laboratory. So we're averaging now about 4 to 5 days on the results now. So it's not a Brownsville thing, it's a laboratory capacity issue that we're starting to see now.
Now, on the state testing numbers, I asked this question this morning on the hospital call, and Chief Sheldon didn't have the answer, but I'm wondering if maybe you do. Do you know how many tests were administered by the state last week on last Monday and Wednesday? The state came down and did the state-sponsored testing last Monday and Wednesday. Do you know how many tests were administered, and do we have any of those results back yet?
So we're actually scheduled to be on a call with DSHS on Thursday. We will ask that question. We will send an email to them and see if they can provide us those numbers.
Okay, thank you.
Yes, sir.
Hey, can I report on the downtown homeless efforts?
Yes, please.
Okay, so Saturday we were out there for the 3rd time, and we saw about 25 people. Nobody had, I think one guy maybe had a 101, but everybody else was in the right range. And the Ozanam Center provided bags. Matthew Cruz and another company provided masks that they were really happy about that. And so we'll probably go back again in 2 weeks. But if there's a way to get some of them tested, that wouldn't be bad. Or if there's a way to get over there, because you're not going to get them anywhere else.
Would they be willing to submit to testing though, Commissioner?
Well, not to be mean or anything, but when you have that goodie bag, you know, we have hygiene products, we have food, and we have other things in there that are helpful for them. So, you have a little carrot out there, and I think you could probably do it.
Okay.
I agree, Commissioner Neese. I think that it would be very great to test the residents or the folks that frequent the Ozanam Center and any other shelter of a similar site. I would imagine, in Art, you can check into this, that you can remotely register them just like the hospital was, and then use our supply, the city supply of tests, but you would have to have someone who's trained to do the test.
That would be great, but these are the people that are actually at 13th and Adams. They're downtown homeless people. So
let's talk about the folks on that block.
Yeah, two nurses, Julie Bannert and Maria Zoneveld, were they're registered nurses, and they were doing the temperatures, and we had a little screening questionnaire as well, ask them about how they're feeling, if they have any symptoms or anything like that. But everybody pretty much checked out.
We definitely would look into that. I do want to add there is an initiative that we're looking at working through the Housing Authority of a walk-up drive, the equivalent of a drive-through, but a walk-up. There's an email where we ask the Housing Authority that if they do apply for that grant and that does become available, it would be a grant for this the original Brownsville town site. But however, that's a grant that may or may not happen. However, more definitive, I definitely will reach out to the CEOs and see if they can lend a nurse to potentially become part of a group that can come through the downtown area and do something like that, Commissioner.
Yeah, you're looking at probably less than 30 people that congregate around that area, and they put out the word, and they come out.
And I'll be more than happy to have a conversation to get an idea and then reach out to the CEOs. I am sure with what we're doing and their ability to get a nurse out there in the community that we can work something out.
I'll share you this. We're doing these screens on these forms, right? So I'm compiling all the names and the people involved in the screening with a little spreadsheet. So I'll get that to you as soon as I finish it up.
Yes, sir.
Dr. Rodriguez, in the event that grant isn't done, and even in the event that it is, I'd still like for the city to consider doing a mobile testing lab. I think considering some of the CARES Act reimbursements we're eligible for, I think that would be something that would be very valuable, and we get a return on that investment if we find a way to create a mobile testing lab.
So Marty and I met with Belinda, Dr. Reiniger today to begin that conversation of maybe not necessarily mobile as in a car, but pop-up shop, pop-up places that, so we're beginning to have that conversation. We should have more hopefully next week.
Along that line, Mayor, as long as there's money to be had out there, I would like to encourage the city manager to try to see if there's something to do to address the digital divide. Kids going to school or not being able to go to school are being greatly affected. They're having to do their classes on telephones if they're lucky enough to have one with internet service. So this would be a really important thing to look into right now.
I agree, Commissioner, and we've actually had that conversation already. So I would reiterate it again here because of your statements. But yeah, we have had that conversation. But hopefully that's something that can move forward because I think we may be eligible for some of that funding.
Good. Okay.
Yeah. Any other questions? Okay. Thank you.
Thank you. Yes, sir.
Next, we have items for individual consideration. Number 1, consideration and action to approve the city manager to authorize purchases above the formal solicitation threshold in response to COVID-19.
Mayor, City Commissioners, on March 24th, City Commission approved city manager the authority to purchase above the city's formal solicitation threshold in response to COVID-19. The limit was limited to 250,000 to date. We have about 30,000 in PPE emergency reimbursements and about 200,000 relating to drive-through testing. Drive-through testing has been one of the major focus on this emergency procurement, and it has paid dividends for the city. Because of this, that we're going to be reaching the limit of 250,000. We're requesting that this threshold, this amount limit be increased in order to respond only to emergency procurements related to COVID-19. Staff recommends an equal amount be approved for City Commission to continue this emergency procurement.
So we've been doing that for 2 months, pretty much, 24th of March through now.
Yeah, that's correct.
So are you asking for that approval for 60 days again? Because last time it wasn't really clear how it was going to.
The dollar limit was initially, the dollar limit could be at the commission's discretion, but the dollar limit was 250,000. 250,000 has pretty much gotten us to this point in time. And we're requesting that a similar dollar limit to give us threshold so that we could continue with, it's mainly drive-through testing costs that are associated with this. And if we need to, any PPE supplies emergency procurements if needed. But right now we do have some local sources of that, but we never know if that will be needed on an emergency basis.
And just to clarify, I did ask that this item be put on the agenda because I knew that we were rubbing up against that 250,000. I think we're at about 220,000 now. Like Lupe said, the majority of that money has been through the drive-through testing initiative. The other 30,000 or so has been PPE. So I just figured that since we were coming up on that spending limit, it would be a good idea to address it again and allocate some additional funding.
So should we allocate 250 for the next 60 days? So we can review it again in 60 days, based on our expenditures so far.
I think that's fair.
I agree.
Yeah, testing is pretty important. So if there's, I'll be happy to make that motion, 250,000.
We have a motion and a second to authorize an additional $250,000 over the next 60 days. Any further discussion? Those in favor?
Aye.
Aye.
Those opposed? Motion passes. Thank you.
Thank you.
Next, we have action item number 2, consideration and action to award change order number 9 to Spa Glass Contractors, Inc. for the terminal project in Brownsville South Padre Island International Airport in the amount of $1,512,915.39.
Good afternoon, Mayor and City Commissioners. The item before you is change order number 9. There's about 6 items that encompass this change order. The first one's the airline build-out cost, the commercial canopy construction, which is going to be constructed on the commercial lane, parking lot booth and infrastructure for a parking lot, install mechanical curb roof cutouts for the concession space areas, install gas line, which was requested by the Texas Gas Company, and to install a grease trap fence for the concessions. The total cost of change order number 9 is $1,512,915.39. The airport recommends approval of this to Spa Glass.
Okay, do we have any questions or any motions on this item?
I have a question. The finish outs for the airlines are going to be reimbursed. Is that correct?
So we kind of ran into a snag with that. At the very beginning, we went to the airlines to get their engineers to actually do plans and specs for us that matched their branding and their style of decor. That kind of fell through right in the middle of conversations. So what we did is we went back and gave direction to our engineer to design just basically a white box for them. So the construction build-out cost for those two areas went down substantially from what their original branding style for both airlines would be. We are going to renew their airline agreement and impose an increase in their rates and charges, but they will not be paying for this initial build-out.
But they'll be essentially be, pay for it through their rent or their rates paid to the city.
Yeah, it'll be paid through an increase their rates and charges, but it's not specifically saying that they're paying for the construction build-out.
Understood.
And the largest cost here obviously is the canopy. Is this something that was left out for some particular reason? I know that initially there were some things that were held back based on funding. Is this, I'm assuming, one of those items?
Actually, the commercial canopy was something that we added in. We thought it would be something that would be kind of a nice addition to have some coverage on the commercial lane for cabs and shuttle buses as passengers were waiting. So it wasn't actually part of the original bid, but we thought it'd be an added, it'd be a nice addition to the project for the passengers waiting for shuttles and cabs.
Is it something that would enhance the customer experience, or what is the purpose of this?
Yeah, of course, it would enhance customer experience as well as customer satisfaction, so they're not standing on the commercial lane getting wet during inclement weather. Yes.
Absolutely. Okay. Thanks. Any reason why this wasn't included in the first place then, if it makes so much sense?
Well, that's a good question to ask the designers, but we just kind of thought it we kind of thought it would be something nice after the fact. They did not think about it. I think they were just more concerned with the design of the building, and we kind of came up with this afterwards. Kind of a valued engineering idea after the fact, if you will.
My understanding is it's going to be incorporated into the design of the rest of the facility as well, right?
That's correct.
Okay.
Well, it's $1 million add-on, and it should have been thought out, but I agree that it's something that's going to enhance the airport quite a bit.
Any other questions? Okay, I'm looking for a motion.
Move to.
Second.
We have a motion to approve and a second. Any further discussion? Those in favor?
Aye.
Aye. Those opposed? Motion passes.
Next, we have action item number 3, consideration and action to award Arcaronas $312,501 to provide the terminal seating for the terminal project at Brownsville South Padre Island International Airport.
Afternoon, Mayor and Commissioner, again. This item before you is actually the purchase of the terminal seating, which will be used for the second level of the terminal. There'll be approximately 291 seats purchased. These seats have the availability to have chargers installed at a later date, which will be coming to you at a later date for that type of technology solution. This is a purchase through TIPS through the company called Arconis. And the reason we chose Arconis to do this is because they had an amulet ballistic solution that would be sporadically throughout the chair solutions, which other chair seating companies do not have. So that's why we kind of chose them for this purchase. And again, we're purchasing through the TIPS program. And we recommend award for $312,501.
How many more times do you anticipate coming back with any of these change orders? Is this pretty much it, or what else you have on the horizon?
Well, this isn't basically a change order. This is actually a purchase directly through the seating company. We do have several other change orders that will be coming to you through additional, mostly technology solutions that will basically enhance customer service. Some of it will eliminate touch points throughout the facility as well. But I think we're getting pretty close to the last portion of the change orders for construction.
I think I can be a little more
That's
specific.
$1.5 million. And I know there are people in the community that were very concerned about cost overruns. But
Definitely. And Mr. Walker, I think, was going to add some input.
I'm sorry?
Yeah, yeah, can you hear me?
Yes.
Okay, so to be more specific, we actually anticipate to come back packages. There was a lot of I guess redesigns on some of the CBP equipment that was in the federal inspection station for the airport. So that package is going to come back as a change order with spa glass, and then we also have a package of FF&E, so furniture, fixture, and equipment. Things like the floor buffers and some of the smaller equipment items that we'll need to put into the terminal. So those are the two packages we're expecting to bring within the next couple of weeks, probably at the next, one of the next two commission meetings. We shouldn't have much more beyond that. And then you were saying something, Commissioner Neese, about the public sentiment for expanding the project.
Well,
you want to go ahead and
that's
ask
part
that?
of some of the previous blowback or pushback on this throughout the history of the new terminal. But just adding $1.5 million on two change orders, we'd like to get a little perspective focus on what you're going to do, because at some point we're going to have that total cost, and it's going to be different than the total cost that was presented before toward the community. So, as you know, we're the ones that take the heat for that kind of stuff. So,
of course,
trying to put it out on the table.
Right, right. So I think that the total cost of everything included is going to be in the neighborhood of $70 million. The original cost, and why this sounds so much different, is because we've always broken up the project into several different phases or different components. The initial cost that was estimated, or at least the city was hoping for, was about $30 million. The CBP was engaged later in the development of the project, and their minimum requirements for their federal inspection station caused the project to expand by 30%, all by itself. So the square footage of the building itself increased by 30,000 feet just because of CBP's involvement. Now, that's not to blame them. That's just to explain the cost and the expansion.
And so then I think it got to about 50 million. But now I think it's important, and this is a good opportunity to explain to the community that part of the rest of it was on the airport or the runway side of the project, right? So now we've gotten past to the terminal part where you're factoring in the tarmac side, right? So this is something that's good for the community to know, so that they don't think, well, we're just adding on because it's nice or something, right?
Right. So we've, after the CBP expanded the size of the terminal itself, the building, the airside portion was separated from the whole project, so it could be funded by a different type of money that the FAA, at a different rate, the FAA would be they would participate at. So they participate generally with the airside portion, and what you're talking about, the tarmac, the apron, the ramp area, where we park aircraft. All of that is eligible generally at a 90% level. Because of the current COVID situation, all grants issued in 2020 are being issued at 100% level. So we fully anticipate 100% grant on
And
the
you
airside
weren't before,
portion.
right? You didn't think you
Correct.
were getting that much, so that's a windfall on that. So that'll
It
help.
would be well over $1 million of the match. I wouldn't say well over, but over $1 million is what we were anticipating the match to be.
That should cover the
just for the
canopy then.
airside. That's what we're hoping. Yes.
Great. I think we're all looking forward to the opening of that terminal.
Mr. Walker, have you heard any issues or concerns from the FAA on funding due to our current crisis I guess you could say economic crisis as well, and maybe some reluctance from Washington to disperse some funding going forward?
No, it's been the opposite. We've heard that they're being instructed to speed up the allocations of funding. They have all of their funding in place for the AIP program, as well as the CARES Act funding. So we've already signed the agreement that was accepted by the commission a few weeks ago, and we sent that back to the FAA. They've given us instructions on how to already go ahead and start with the drawdown requests for those funds. And for the existing grants that we have 4 currently on the terminal. We've already drawn down more than 17 million of those grants. So they're actually, they're reimbursing us and processing it as quickly as possible.
Okay,
and that is their instructions.
That's great news. Okay, thank you.
Thanks, Brent.
Thank you.
Anybody else? Okay, I'm looking for a motion to award Arconis $312,000 for the terminal seating.
I'll make the motion to approve. It's Nerith, by the way.
We have a motion from Commissioner Galansky. Do I have a second?
A second.
A motion and a second. Any further discussion? Those in favor?
Aye.
Aye. Those opposed? Motion passes. Thank you.
Thank you.
I'll move to adjourn.
We have a motion to adjourn
Second.
and a second. Any discussion? Those in favor?
Aye.
Aye.
Stand adjourned. Thank you, everybody. Have a good evening.
It is now 6:14, end of meeting. Thank you.
Thank you.